Hi everyone. Now let us discuss MCQ of remaining MCQ from breastfeeding. In previous class we have discussed almost 30 to 40 questions of it. So now let us see remaining of it. The first you see the question, advantages of breastfeeding. So they asked a question just to find out the advantages of breastfeeding. So here you see advantages of breastfeeding. First one, increase the bond between mother and child, and second one, it keep the baby well, and not only that, it control the breast cancer. It control the risk of breast cancer. Then this one is not a advantages of breastfeeding. Change the breast step is not advantage of breastfeeding. Then next question, advantages of breastfeeding except. So find out the advantages of breastfeeding in this statement except. Okay, so here you see the first one, it promotion of gastrointestinal function. Then next one, it develop the immune power in infant, and not only that, it has economic advantage. Breastfeeding uh, has economic advantage. No need of buying outside, so infant get naturally. So that's why it has the economic advantage. The next one, here the same question they asked, advantages of breastfeeding except. So in this statement, it provide nutrients to the baby, and not only that, it provide high level of human. Already we have discussed in this. And next one, it has the power to control the gastrointestinal infections in baby, and it provide adequate iron is not a correct statement or not a advantage of breast milk, because breast milk contains low iron or lesser amount of iron, and that is to 0.4 to 1.5 milligrams per liter. So once we recall what we have discussed up to now, change the breast shape, nutrition imbalance, and provide adequate iron. So these three statements are not advantages of breastfeeding. Okay, the next one, who is primigravida? The woman who is pregnant for the first time called the primigravida. Okay, the next one, next question, in preparing primigravida for first time, in preparing a primigravida for breastfeeding, as a nurse, what you will do? And the answer is, as a nurse, as a nursing officer, we have to tell the primigravida, start breastfeeding immediately after delivery, because it decreases the amount of blood loss due to oxytocin secretion when baby suck the nipple. So as a nursing officer, you have to teach the mother, start the breastfeeding after delivery as soon as possible. And when baby sucks the nipple, it increases the oxytocin. And because of that oxytocin, this oxytocin hormone has the power to control the blood loss. Then, next one. Next question. Nursing care for cracked nipples or irritated or sore nipples. Nursing care. Then the answer is, expose the nipple. Tell the mother to expose the nipples to air as much as possible. And this is all about care of cracked or sore nipples. So as a nurse, what we have to tell the mother, apply Vaseline or edible oil or any antifungal ointment around the nipple, and wash the breast and nipples with clean water. Avoid the soap that causes dry of nipple, and tell the mother to follow proper techniques of breastfeeding. And not only that, tell the mother, dry the nipples thoroughly by exposing to them air, sunlight or hair dryer. And not only that, encourage the mother to wear nursing bra and support her which this one. Okay, so this nursing bra supports her 24 hours per day. And next, tell the mother, use soft disposable fabric pads so that absorbs milk leakage. and encourage the mother to continue breastfeeding. And not only that, between feeding, tell the mother should be aired, the nipple should be aired. Tell the mother between the feeding, the mother should air the nipples. Okay, so this is about the care of a cracked or sore nipples. Tell the mother wash the breast and nipples with clean water. Avoid the dry soaps and avoid the soap that cause a dry nipple, and teach the mother proper breastfeeding techniques, and tell the mother expose the nipples to the air, sunlight or hair dryer, and encourage the mother to wear the nursing bra that supports 24 hours per day, and tell the mother to keep soft disposable fabric pads that absorb the milk leakage, and encourage the mother to continue breastfeeding, and tell the mother dry air the nipple between the feeding. Then next question, what is mastitis? Inflammation of mammary gland called mastitis, and this occurs generally during breastfeeding, and it occurs, the mastitis occurs in second and third postpartum week, and the causative agent of this mastitis is staphylococcus, and the symptoms you can observe in the woman who has this mastitis is fever, acute breast pain and swelling. The next one, contraindication of breastfeeding. The first one is mastitis, and during acute puerperal illness, carcinoma, if the mother has HIV, if the mother has a chronic cracked nipples, breast abscess, any injury or any surgery to the breast, herpes simplex. So at this situation, the mother must contraindicate feeding to the baby. And if the neonat has these problems, the mother should not feed her baby. That is very low birth weight, asphyxia, galactosemia, and severe cleft palate. Okay, and what is galactosemia? Galactosemia is nothing but galactose. Development of galactose in the blood is called galactosemia. Nothing but if the body unable to process a sugar, nothing but galactose. If the body unable to process a galactose sugar in the body, so there is a chance of developing galactose in the blood and its byproduct. Finally, it damages the cells and organs. So this is called the galactosemia. So simply you can remember galactose, the development of galactose and its byproducts in the blood is called galactosemia. The next, what is meant by breast engorgement? Breast engorgement. The breast engorgement is nothing but a painful swelling of breast is called breast engorgement. The swelling of breast or painful swelling of breast called breast engorgement, and this we can see in early postpartum period. So that's why we can also call this one early postpartum engorgement. And the main cause of this breast engorgement is due to buildup of lymph and blood, and commonly we can see in first weeks after birth or third or fourth day of delivery. Okay, so here what are the methods we can use to prevent the breast engorgement in the postpartum period? Okay, the first, to tell the mother give the breast feeding at frequent intervals, and tell the mother apply local warm packs, and can also use the breast pump for gentle expression of milk, and tell the mother to wear the support bra. Okay, the next one, full form of BFHI stands for Baby Friendly Hospital Initiative, and this Baby Friendly Hospital initiative launched by UNICEF and WHO in 1992, and the aim or objective of this BFHI is to encourage and promote the exclusive breastfeeding, only breastfeeding, and it consists of 10 steps. So in next class I tell you that these 10 steps of BFHI, and already we discussed objectives of BFHI is to promote breastfeeding, and the full form of Afghan. Appearance: P stands on pulse, grimace, activity, R stands on respiration. Thank you all. In the next class, I tell you remaining MCQ of it. Thank you. And don't forget to subscribe my channel.